And now it's time for the sponsor perspective portion of the program and a message from the sponsor of today's event, the Diabetes Leadership Council and the Diabetes Patient Advocacy Coalition.
Hello, my name is Marilyn Serafini, and I'm Director of the Health Project at the Bipartisan Policy Center. Our mission at the BPC is to foster bipartisanship by combining the best ideas from both parties. And yes, believe it or not, bipartisanship is still possible. The panelists you're about to meet represent a group of 13 nonprofits that came together over the summer to develop a consensus statement on healthcare reform for people with diabetes. Our panelists are George Huntley, CEO of the Diabetes Leadership Council, Kate Thomas, Director of Advocacy for the Association of Diabetes Care and Education Specialists, and Christina Roth, CEO of the College Diabetes Network. Let's start with you, George. The Diabetes Leadership Council spearheaded this project. Could you please share a bit about yourself and the council and why you felt this was an important project?
Sure, Marilyn, thank you. I've been living with type 1 diabetes for 37 years, and in my day job, I've been the plan administrator of a self-insured health plan for over 22 years. I'm currently, as you noted, the volunteer CEO of both the Diabetes Leadership Council and the Diabetes Patient Advocacy Coalition. The Diabetes Leadership Council is a group of experienced leaders from the diabetes community who are passionate advocates for people with diabetes. We're a nimble policy shop that gets involved in issues at both the federal and state levels. DPAC is a coalition of thousands of grassroots advocates from across the country who make their voices heard through our CLIC advocacy engine. Together, we're able to provide federal and state legislators with timely expert policy input as well as passionate patient stories to make the issues real. We were very pleased to have worked this summer with an amazing group of nonprofit partners in the development of the consensus statement on U.S. healthcare reform for people with diabetes. The pandemic has exacerbated the gaps in our current system, and it is our hope that the next Congress will take up the important task of closing these gaps. We prepared this paper to provide tangible recommendations for both commercial insurance and the Medicare and Medicaid programs that can improve health outcomes, lower patient cost, and lower the overall burden of diabetes on the U.S. health system by reducing the costly complications that result from uncontrolled diabetes. Diabetes is the ultimate you can pay me now or pay me later disease, and the U.S. too often opts for pay me later. A person with diabetes must have affordable access to the medicines, devices, education, and services they need to be successful in managing their disease. It can't be a function of socioeconomic status. Hopefully the panels today have illustrated some of these points. And I would like to briefly thank the organizations that came together for this important effort. In addition to the DLC and DPAC, we partnered with the Association of Diabetes Care and Education Specialists, Beyond Type 1 and Beyond Type 2, the Certified Board for Diabetes Care and Education, Children with Diabetes, the College Diabetes Network, the Diabetes Dietetic Practice Group of the Academy of Nutrition and Dietetics, Diabetes Sisters, the Diatribe Foundation, JDRF, and T1D Exchange. I'd like to personally thank them all for their valued input. Now, the consensus statement can be found on the DLC website at diabetesleadership.org. And Marilyn, thank you again for your help in moderating this session today. It is so greatly appreciated.
Thank you, George. So let's turn now to Kate Thomas with the Association of Diabetes Care and Education Specialists. Kate, could you please tell us about your group and what you'd like to highlight about health reform needs from your group's perspective?
Absolutely, Marilyn, and thank you so much to George and the DLC and DPAC for really putting this together. I think it spoke to the need within the diabetes community to really come together around some of these policies concerning healthcare reform and put together a document that we could all get behind and develop a strategy to take this both to Congress and to the administration and to other stakeholders to speak with this collective voice on these important issues. And so I am the Director of Advocacy at the Association of Diabetes Care and Education Specialists. You may know our organization by our previous name, the American Association of Diabetes Educators. We went through a rebranding in early 2020 to better reflect our membership and the role of our organization in healthcare. We're an interdisciplinary membership association dedicated to improving prediabetes, diabetes, and cardiometabolic care by optimizing this care and reducing complications. And we represent over 12,000 diabetes care and education specialists. And these individuals include nurses, registered dietitians, pharmacists, and others working to achieve these shared goals. And so we've been having a lot of conversations, as I mentioned, with our members about some of the challenges that we're seeing at the practice level, given that we do represent providers that work with people with diabetes. And George so eloquently captured a lot of the priorities that our members were seeing in terms of ensuring that all people with diabetes have access to the care that they need. And one of the areas that we're most interested in, and so glad to see this consensus statement reflect, is changing policies around diabetes self-management education and support, and diabetes self-management training, which is how it's referred to under the Medicare benefit. And we really believe these series of policy recommendations will help to change this benefit and increase utilization of the benefit and reduce some of the barriers that we're seeing there. So thank you, Marilyn. I'll turn it back over to you.
Thank you, Kate. So now let's turn to Christina Roth, founder of the College Diabetes Network. Christina, you have an amazing story on providing programs for students leaving home for the first time and having to deal with a chronic disease, as well as a new educational environment. Tell us a bit about the network and what you hope the review of health reform could do for your constituency.
Absolutely. Thank you so much, Marilyn. As Marilyn mentioned, my name is Christina Roth, and I'm the Chief Executive Officer of the College Diabetes Network. I've also lived with diabetes for 15 years myself. And with CDN, we're focused on young adults with diabetes across the country to help them be motivated and equipped to live a healthy life, to pursue their dreams without compromise. And that is so much of what connects our mission to the work that we did with our partners around this reform resource. Is our young adults are at a point in their life where it really is a pay now or pay later. But the choice to pay later also takes away the productivity of some of the best years of their lives. So what our young adults are fighting for and want you to consider is investing in them and their health now, so that they can be the citizens that they want to be and have the productive lives that they can live. So speaking as an advocate for young adults with diabetes, I want to leave you with the fact that young adults with diabetes have some of the most disproportionately high A1Cs compared to any other population. And yet, if an intervention happens now and supports young adults through this time, they have years of life ahead of them of productivity. And they want that productivity. So as you read these recommendations and you think of this consensus, please think of the people behind this and how desperately they want to have access to healthcare so that they can contribute to society and be part of everything that we're all working for.
Thank you, Christina. And thanks to all of our panelists for your hard work to develop this consensus statement on healthcare reform for people with diabetes. And thanks to you, our audience, for joining us at this session.